Everyone. So the agency that I chose to research for this project is WIC. WIC stands for Women's, Infants, and Children's Supplemental Nutrition Program. I currently live in New Braunfels, so my research on the organization was centered around here rather than San Antonio. Their home base is in San Marcos, but there are 5 other clinics in the surrounding areas. That includes Kyle, Seguin, Lockhart, New Braunfels, and Selma. Their sole mission is to help families grow healthy. This is done through education, encouragement, and empowerment. Even with 6 locations, there's one hotline that you could call in order to be directed to either one of them. That number is 512-393-8040. Together, they have over 5 health and nutrition supervisors, 1 to 2 health and nutrition specialists, 5 WIC clerks, and over 3 breastfeeding counselors. The woman who I had the pleasure of interviewing, Stacey Olveri, is currently the nutrition and breastfeeding coordinator with specialties as a registered dietitian and lactate dehydrogenase. Going back to the foundation of the agency, in 1972, the federal government established the WIC program in order to provide assistance for children living with low-income families. 2 years after the foundation of the program, 88,000 people were enrolled and receiving benefits. As of 2013, that number has skyrocketed to 8.6 million. To put a scope on that situation, this organization provides nutrition assistance to over 50% of infants in the United States. The WIC program is funded through the United States Department of Agriculture, known as the USDA. This agency provides funding to the state, then it's dispersed to the recipients through the various contacts, such as county health departments, municipalities, hospitals, universities, and various nonprofit organizations. 78% of their budget for 2019 has been put into personal services for their clients, and another 16% for contact services, such as lactation consultants and peer counselors. Poverty and hardship can have lifelong consequences for young ones, physically, mentally, and economically. Care can start while the mother is pregnant, making sure the baby is receiving the right amount of nutrients, going into infancy, and thus throughout the early childhood years. Like anything else, this agency is based off a chain of command. We have the clerks who are front and center dealing with the clients, health and nutrition specialists next in line that get more of that one-on-one interaction with the beneficiaries, on to their site supervisors who overlook their work. Then you have 2 WIC program supervisors and WIC nutrition coordinators, making sure all 6 locations are on the same page. Lastly, you have the WIC director, who assists in all outreach responsibilities and implements the system. Eligibility is based off a few factors. The federal poverty level has recorded in 2019 that a household of 4 meeting an annual income of $25,750. The WIC program states in order for a family of 4 to qualify for assistance, they must show proof that they do not exceed 185% of that federal poverty level, putting them at an annual of $46,440. Benefits can also be guaranteed with proof of TANF, SNAP, or Medicaid. WIC can have a positive impact on families and government finances. For pregnant women, about $2.90 is saved in Medicaid within the first 60 days of giving birth. That may not seem like much, but it is wonders for mothers who are struggling to provide for their young ones, or first-timers who are having trouble getting their babies to stay awake during feedings. When applying for benefits, all persons receiving them must get weighed, measured, and get their iron levels checked. The agency may also need to access information such as personal health, family health, medical issues or concerns, and nutritional status. They also question your living situation and the function of your supplies. This includes things like clean running water and a working refrigerator or stove. Additional services can be introduced if they are needing or not affordable or reliable. Lastly, you must be a resident of the states that you are receiving the benefits from. but you don't have to necessarily be a citizen. A few of the nutritional categories that WIC provides include infant formula, cheese, vegetables, bread, and peanut butter. Also available are no refrigeration packages, gluten-free, even alternatives such as soy and evaporated milk. In addition, WIC provides online classes, group classes, and individual counseling to mothers who feel a need. They try hard in providing the utmost care for those who cannot find means otherwise. Also available are personal consultants on site or over the phone for issues related to diabetes help, tube feeding, and breastfeeding issues. Close relations with the food bank are there to help with nutritional needs as well. For example, if you take your shopping list, which is a list of all the food that is available to your family per month, to the food bank during their farmers market, you can take home $30 worth of food. That's really good. I believe that WIC really tries to help all of its clients in the best way that they can. Thank you all for watching and have a good night.